Good morning and welcome back. Today we have Spencer Smith joining us, a certified physician's assistant at Piedmont Urgent Care. Thank you for being here today.
Oh, it's a pleasure. Thank you guys for having me.
Well, I'm glad to have you because we have an important topic. We're getting into faux fall, almost fall, and talking about cold and flu season, which is almost here. You know, we're heading into that season. What are you seeing in the clinics right now?
Well, fall is everybody's favorite time of the year, right? Football's coming and all those fun things. But we see an uptick in viruses and bacteria and things like that. So we have a lot of volume. We get a lot of people coming into the clinic. Do I have flu? Do I have COVID? Oh, my sinuses. There's all these things happening. So we have a lot of volume.
That's a lot. Now, how can Piedmont Urgent Care help patients figure out what they're dealing with? You know, a lot of times we go to WebMD or we self-diagnose ourselves, but how can we fix that?
So what we've introduced in our clinics is we have molecular testing, which somebody's referred to as PCR testing, but it's really the gold standard of infectious diseases. So we can figure out, is this a virus? Is this a bacteria? And with incredible accuracy, we can tell what it is and how to treatment right there while you're in the clinic.
Just from that PCR testing?
Exactly.
That is incredible. Now, what makes that testing different from a rapid test that people may have used before at home? What's the difference?
Sure. So I like to explain things in analogies so people understand, because you look at the rapid test, which is kind of like, okay, I look at the surface. So think about what somebody wears. You know, sometimes you can see somebody right away, oh, they're wearing this, that's so-and-so. But if they wear something different or they're not familiar or people have similar fashions, you may not be able to recognize them. So on the surface, you may not be sure who it is. But when you look at molecular testing, it's more specific. So imagine looking at your fingerprint, right? Everybody's fingerprint is very unique. It's the exact individual. So it can tell whether what you're wearing or what you're doing or how far you're away, exactly who that person is. So that's what molecular testing does. It looks at the DNA or the RNA to figure out exactly what's causing it, where the rapid test only looks on the surface and depending on what you're wearing can be different. And that has to deal with viral loads and other things. But that's where you look at it. Remember, molecular, very specific, strict identification, where rapid can be confused depending on what you see and how you see it.
So it is better to get that molecular testing if
Very
possible.
so.
All right, now what makes Piedmont Urgent Care different than other urgent cares or quick care sites? What separates you?
Sure. So at Piedmont, we like to think that we're accessible and we're oriented on the people. We want to help them and we want to be available in their time of need. So people are able to walk in, they're available to log in online. They can use piedmonturgentcare.org. They can come in, we can test them right away, we can find out what they have, and we can give the right treatment at the right time. And not only can we do that, we can also dispense medications within our clinics.
Wow, that really is incredible. Now, for someone who at home who feels sick, when should they decide, you know, to go to Piedmont Urgent Care rather than just stay home and stick it out?
Sure. This is very simple. It's if you have that thought, should I go see the doctor? That is the time. So at Urgent Care, we're accessible. You don't have to wait 3 months. You don't have to wait a week. You can come same day. You can be seen by a licensed professional with medical expertise. You can have accurate testing. And with our molecular testing, guess what? It's one swab.
Wow.
Nobody likes all
you
the
have
swabs.
to do.
One swab, and we can tell bacteria, virus. We could determine COVID, flu, strep, STIs, all that's offered. You can get it in the clinic within about 15 or 20 minutes. And then on top of that, we can get the medicines dispensed in our clinics. And then what really sets us apart is we're part of the Piedmont network. So being part of Piedmont, we have access to specialists all across the state, the latest hospitals, the latest diagnostics. If you need to be there, you're already in the system. We use the same electronic medical records. You don't have to worry about your medicines. You don't have to worry about your past medical history. We can seamlessly get you where you need to be at the right time for the best care possible.
Just through that one urgent care visit.
Exactly.
That is incredible. To find out more about this, and if you think you may need to go to urgent care, like we just talked about, if you have the question, head on over. But if you'd like to find out more, head on over to our website, 41nbc.com.
The best